Hello and welcome. My name is Kelly Rosetta, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. We are thankful that you are taking the time to watch this as we embark on our first virtual presentation in our new series entitled Health, Literacy, and Me. Today's speaker is Van Vu, Doctor of Pharmacology, who happens to also be a lupus patient. Now, Dr. Van will be breaking down a medication that is one of the 4 FDA-approved medications that most lupus patients know all too well. We are talking about prednisone in today's session. We hope that her presentation helps answer any questions that you may have regarding this medication and help debunk the fear of the unknown. Because, as Marie Curie once said, nothing is to be feared, it's only to be understood. Now is the time to know more so that we may fear less. Now, the data and the comments that you are about to hear are for informational purposes only and should not replace the advice of your personal physician. If you have additional questions regarding this medication, please reach out to a medical professional. So thank you and welcome, Dr. Van. Hello.
Hi, thank you so much for having me.
Oh, it's always our pleasure. Now, Dr. Van, we're just going to get right into today's discussion and talk about the medication prednisone, or some of us call the devil's Tic Tacs, as they are the best and the worst drug ever. So let's just start off with the most common question. What is the brand name and the generic name of this medication?
Sure, Kelly. Let me go ahead and just share my screen here. Let's see. Alrighty. Hopefully everyone can see. Is that okay on your end?
That's okay. It looks great.
Okay. All right. So as Kelly mentioned, I am currently a pharmacist working in the community setting, and I get a lot of questions about medication. So we thought it would be great to get together and share with you on the most common medications for lupus. So today we're talking about prednisone, and prednisone is the generic name. Brand name of prednisone is also called deltasone. And rarely nowadays you will see the brand version of prednisone because the medication has been around for so long that generic version will always take priority, I would say, in the community setting because one, it's cheaper, and now brand name isn't really making much more than the generic version, and so most pharmacies will carry generic.
Wonderful. And what is it typically used for?
So prednisone is an anti-inflammatory or immunosuppressant agent that's FDA approved for a variety of diseases. And for us, lupus patients, it is FDA approved for that, and that is considered an autoimmune disease. However, prednisone can be used for many other diseases that include gastrointestinal diseases like Crohn's disease, which is also autoimmune, rheumatic diseases like rheumatoid arthritis, and even lung diseases as simple as asthma or COPD, which is chronic obstructive pulmonary disease. And then in addition, prednisone is used for many other off-label indication, which is the word off-label just means that it's not yet FDA approved for the use of a certain indication. And I think what most of us have seen in news recently is an example of the off-label use is the coronavirus disease.
So It just off-label means that it is an FDA-approved medication, but it's just not FDA-approved for a particular condition, disorder, or disease.
Exactly. So,
That's not on the list.
right. So it's not what we call an FDA approved indication. The
Got it.
medication itself has been FDA approved for other indications, but it's, you know, they're used for other things that's not been approved by the FDA because it's such an effective anti-inflammatory and immunosuppressant agent.
Mhm. And how does prednisone work?
Um,
Let me go back. Let me ask first. Because I want to ask this question. How is it administered? I want to ask that one first.
okay. So prednisone is administered orally, either as a tablet or a oral solution. And keep in mind that this is just for prednisone. Prednisone does have other what we call family members. That's considered also considered a corticosteroid or glucocorticosteroid, which is used interchangeably. And those can come in other types of formulations, especially when you're in the hospital or in other types of settings. Prednisone in particular is only as a tablet or oral solution. And the doses when you first start to take prednisone can range anywhere from 20 to 80 milligram per day. And then that is typically slowly tapered off. So the dose is slowly decreased to a low dose that patients in the lupus community may take chronically. So, for example, 5 milligram a day or 10 milligram a day, even as low as 1 milligram per day. But when you first typically start prednisone or when you're flaring up, it's typically anywhere from 20 to 80 milligram per day. And I do want to slightly touch on why we taper off prednisone. It's because when your body naturally makes glucocorticoids and when you are taking a steroid like prednisone, your body will make less of it because it's you're taking something in excess. And so when you abruptly stop prednisone without the taper, your body can go into what we call an adrenal crisis. So your body is not making enough glucocorticoids and you're not taking any steroids to supplement that function. So your body kind of go into this shock, and that can be presentable in symptoms such as severe weakness or fatigue. You can have a headache, severe abdominal pain, including nausea or vomiting. And sometimes patients will experience pain in their back or lower legs. And so it's very important to follow the directions from your doctor when you're taking prednisone so that you don't go into something like that.
Yes, that is something every lupus patient should know and take heed of hearing this video because it can very easily happen. Sometimes you just get tired of taking the medication and you just don't want to do it anymore. Other times, too, I know this has happened with me where I had tapered down from a higher dose rather quickly, too quickly. And then I had a medical procedure which caused my body to need that little extra amount of cortisol, which I did not have. And so I went into adrenal crisis, and it's not fun. It can take months for your body to recover. And guess what? You have to go back up on higher doses to work your way down again. And it's a long, tedious process. I appreciate you really emphasizing how important it is to taper and taper safely. So how does it work?
So when you take prednisone or any other corticosteroids, It the way that this works is it interacts within the nucleus of your cells. And so if you look at this picture, you have these molecules that are getting chaperoned inside. So the square here is your cells, and the perimeter is what we call a cell wall. And so when you take steroids, these molecules, it absorbed into your body, the medication is absorbed, it goes into your bloodstream, and it gets chaperoned. So literally what it means, it gets escorted by this protein into the nucleus of your cell, where it'll bind to what we call a glucocorticoid receptor element, which is what GRE stands for. And that alters your immune system to produce less immune cells. So such as inflammatory markers and inflammatory cells, where that ultimately will reduce the inflammation and the inflammatory process so that you're not flaring anymore, or what we considered a lupus flare, when your immune system is going into overdrive.
Wow, that is so fascinating. I've never heard it explained that way. Um, it's so interesting to actually see the process through visuals and to understand what's happening inside your body. It's just so fascinating. And the one thing that's really interesting that I find about prednisone is how quickly it works in comparison to a lot of other anti-inflammatory medications out there, like other immunosuppressant medications like methotrexate. That can take weeks, whereas this can happen very quickly, relatively speaking, depending on your dosage and whatnot. But how long does it usually take to become effective?
Yes, so as pharmacists, we talk about so the time to that your levels within your blood will peak. That doesn't mean that it's going to be effective at that point,
Mm-hmm.
but the time for that to peak in prednisone, that's immediate release, is 2 hours. And then for patients who are taking a delayed release formulation, it can take up to 6 hours. However, because of the mechanism of action of prednisone that you see here, for it to go into your cells and make all these changes, it can take up to several days for you to have a full effect, or for your flares to be resolved. So on average, I would say 3 to 5 days. Um, but that's much quicker than something that could take weeks to help with lupus.
Right. Which, correct me if I'm wrong, is why this medication is used so often to treat any sort of organ crisis. Anytime that our kidneys are, we're dealing with, severe nephritis or pleurisy in the lungs, or different organs that are involved, there's a lot of inflammation, that it's used, maybe not prednisone, but some of the other stronger medications in the corticosteroid family are used as well to treat severe inflammation quickly.
Yes, that's exactly correct. When you are in the state of um, organ failure, or having a severe flare involving your organs, at that point, um, patients may get admitted to the hospital, where they'll administer steroids intravenously as opposed to taking something orally, because that does take time to absorb. And so yes, steroids or corticosteroids can act very quickly. This is specific to prednisone, something that you take orally, which will take slower than something that can be administered intravenously.
And everyone wants to know, before they start a medication, are the benefits going to outweigh the potential side effects? Now, I know Dr. Van, that every person is unique in the way that their body processes medication. But from your research and your studies and what you know of prednisone specifically, what are the most common side effects?
Yes. So I can speak from my personal experience of taking prednisone. I was on prednisone for roughly 1 year after being diagnosed with lupus nephritis. I had to go on what they considered a high dose of steroids. I started out at 60 milligram per day and slowly tapered off. And like all of you, I experienced all the side effects. And so we can start with the short-term side effects. So if you're taking prednisone as a short course, that includes anywhere from a 10-day course or a 7-day course. These may be some of the side effects that you can experience. So the first one is upset stomach. We always tell patients to take prednisone with food for this reason. It reduces the stomach upset. And taking it on an empty stomach, you may feel like your stomach's hurting and it's not very pleasant. The second side effect that you may notice is fluid retention. And for women, this can be most evident in your stomach area. So you kind of feel like your pants are getting tighter. Maybe some describe it as feeling bloated because there's fluid retention around that area. Other patients can notice that in their legs, especially those that work standing. You can see that your legs can kind of look like they're swollen. And then the third common side effect short term is your changes to your mood or appetite. Prednisone is a steroid. It will stimulate your appetite, so you may feel more hungry throughout the day. It can also make some patients feel irritated or anxious. So in a conversation to have with your doctor, especially if you are battling other mental conditions or mental disorders. So it's important to take those into consideration. And then the last one is, of course, insomnia or difficulty sleeping. We tell patients to take the medication early in the day with food. Anything past 3 p.m., you're kind of pushing the boundary of unless you really do want to stay up at night. that's usually the recommendation that we give patients. So that's short term. And then of course it goes away when you stop taking prednisone or steroids. So these are not something that will affect you past your therapy. In women, I just wanted to highlight that long term, you may notice some hair growth on your face, as well as you may experience irregular or absent menstrual periods. It can affect your menstrual cycle. Long term, not to be scaring you, but these are just potential. And I listed all of them. But that doesn't mean that you will get all of these side effects. Again, side effects are listed because there is a potential. It does not mean that you will get the side effect.
Right.
Everyone's different. I did not experience all of these, and I can talk about the one experience, and maybe Kelly, you can share your journey, because I know that Kelly has had personal experience with prednisone as well. But to be brief, long-term side effects, you think of head to toe. It can affect multiple areas or systems in your body. So like I mentioned with the psychiatric changes, so that includes like your mood and your mental health, mental state in particular, high blood pressure, thyroid disorders, your eyes. So due to the increased blood pressure, you can experience glaucoma or cataracts, acne, so your skin. It can also cause stretch marks in the long term. And I personally experienced stretch marks while I was on prednisone chronically. People can experience fat deposits, and so we call this the moon phase. So in the face, it's the moon phase. You have a really round face, which I definitely experienced. Or the buffalo hump is the fat deposit in your upper back, right or behind your neck. In the abdomen, prednisone can increase the risk of bleeding in your intestines. And so sometimes when you're taking a lot of medications, doctors like to prescribe an antacid to help protect your gut. It can increase your blood sugar. So patients who have diabetes, doctors will take that into consideration to monitor their blood sugar. And then growth retardation or muscle wasting. This is more typically targeted towards children in their growing stage. For adults, we're not so worried about growth retardation as you're past that stage. And then of course, prednisone taken for a dose of greater than 20 milligram for greater than 14 days or 2 weeks become immunosuppressant. And so that increases your risk of infection. You're still at an increased risk of infection with a shorter course of prednisone, but it's still, there's still a risk there. It can impair your wound healing, and then prednisone does cause poor bone health. And so it's important to take your calcium and vitamin D when you're on prednisone to prevent your bone from deteriorating.
Thank you for listing those. And it's interesting having a discussion with two individuals that have been on the medication, because we can look at all those things and go, oh my gosh, that's a little overwhelming, particularly, for anyone who's looking at this too, who's brand new diagnosed and their doctor's putting you on this. I can share with you that for the last 30 years almost have been on and off steroids. No, in my younger years, I wasn't put on extremely high doses, which was good and smart, I think wise of my doctors. But I have been on 75, I've been on 60 many times. And for the last 7.5 years, I've not been off of it. Now, because of that, yes, have I seen some fluctuations in my weight? Yes, I have. Has my blood sugar gone up? Yes, it has. My blood pressure has gone up a little bit as well. And my eye pressure is always on the higher side as well when I go to have my eyes checked. So those are the things that I've noticed. Now, my goal is hopefully to get off of it completely, but because of my adrenal issues, it's been a very slow and tedious process. And just when I think I'm about to get off of it, something else comes up and I have to increase my dose due to something else that's going on with my lupus. But I just want to emphasize too that for those that are watching this, your doctor is prescribing this for you because they feel the benefit outweighs any potential side effects. Your doctors have taken an oath not to cause you harm. And they feel that at this moment in your lupus journey, that this is the best choice of action for you, or they want to discuss this with you because they feel it will be beneficial for you to take it at this time. Doesn't mean you're going to be on it forever. Hopefully down the pipeline, there will be more medications introduced for lupus treatment that will maybe even replace this and have less side effects. So that's kind of the goal with this. But I can say, even though I've experienced some of the side effects, which are not pleasant, it has saved my life multiple times. And for that, I am truly, truly grateful to have this medication in our drawer of resources that we can go to help fight some of the things that can happen and the severe inflammation that can happen with lupus. Now, Dr. Van, it is usually, from my experience and what I've read, it's typically prescribed if other non-steroidal anti-inflammatory medications just couldn't do the trick, right?
Yeah, so for us lupus patients in particular, um, you try to limit the use of steroid whenever you can, of course. So patients may be on an anti-inflammatory medication chronically already. That's not a steroid. And then when we do experience flares or any disease activities, when you will see that a steroid will be added on to help minimize the flares from progressing. Um, so if it's just a mild flare like I sometimes get with my skin, there'll be like a skin rash on my hands or my face. My doctors will prescribe prednisone to help um, alleviate that so that it doesn't become a more serious flare like um, a kidney inflammation or I have lupus nephritis, and so that's always the concern with how can they prevent the disease from attacking my kidneys. And so the risk here being putting up with a short course of steroid that may potentially give me these side effects versus going into having kidney inflammation that may cause permanent scarring to my kidneys, and that can reduce my kidney function. And
Right.
so I think that, if I have to put up with, a round face for a few weeks, I rather do that. And like I mentioned earlier, all these side effects do go away when you stop taking prednisone.
Yep, absolutely. And we mentioned non-steroidal anti-inflammatories, but are there any other drugs that may interact with prednisone if your doctor prescribes that for you?
Yes. So I've created a very brief version of this. Um, so as pharmacists, our job is to check for drug interactions when you show up to the pharmacy and pick up your medications. Regardless of what your doctor prescribes you, that's our job. And so with prednisone in particular, there's just one drug that's used for hemophilia, and that is the disease where patients cannot form blood clot. um, and it's called desmopressin, and it's absolutely cannot be used together. Um, I don't think I have never seen a patient that has had to, a lupus patient, I should say, that's had to use, being the both, walking both the paths of being a hemophiliac and a lupus patient. And so I have never encountered this issue before, but if you ever um, are prescribed anything like this, I'm hoping that your doctors are well aware, but that's just one of the things. And
Mhm.
the reason being is it enhances the side effect of desmopressin, which causes your sodium levels to tank. And
I
so
see.
that's the only one. But more commonly, we see lupus patients being prescribed things like antacids to help protect um, their intestines from all the different. So if you're on mycophenolate, that is an acid, and so too much acid can be rough on your intestines. And so if you're prescribed this, just make sure you separate it by at least 2 hours so that it doesn't interfere with the absorption of prednisone. Other thing to keep in mind is if you're on another immunosuppressant like mycophenolate or methotrexate or Benlysta, that it is an amplified effect when you're taking prednisone chronically. So it does contribute to increasing your risk of infection because it's like we discussed earlier, it does calm your immune system down or suppress it. In addition to other agents that you're taking. So just being extra careful in times of now, like with the pandemic.
Mhm.
Um, and then if you're taking it with other non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, diclofenac, celecoxib, which are some of the NSAIDs,
Meloxicam.
meloxicam, it can increase your risk of bleeding in the stomach, which is why doctors will prescribe you with an antacid, something like omeprazole or pantoprazole. This is also known as Prilosec over the counter, if you guys are not familiar with the generic name. Um, so that's just something to keep in mind. You just want to be cautious. You always want to eat with prednisone and other NSAIDs, especially if you're taking them together. And then one thing that most patients do not think about is vaccines. So when you're taking prednisone, it suppresses your immune system, which can potentially make your vaccine not as effective as in a normal person whose immune system is functioning normally. And so if you are not chronically on prednisone or other types of steroids, and you're just, you know that you're going to be taking a short course, I would just wait until you're done with the steroid course to then get your vaccine, because then you're at a better place for the vaccine to do what it's supposed to, which is trigger your immune system to create all these different antibodies to protect you from that disease that you're getting vaccinated against. So this is also in light of the COVID vaccine being available to us now. Any types of vaccine, including the flu shot, is something that you want to keep in mind.
Um, just out of curiosity, can you build up somewhat of a resistance to
Prednisone?
Mm-hmm.
I don't exactly know the answer to from it's not one of the drugs that's in particular that we worry about resistance, but naturally your body will get used to um, you know your medications that you're taking day in and day out,
Mm-hmm.
and so your immune system may need a higher dose of suppression after a long time. I don't have personal experience with it, and it's something that I have to look into to see if there's any sort of resistance that can occur with long term taking prednisone.
Yeah, it's just interesting how your body during different stages of your life can metabolize medications differently. You know, whether you are prepubescent, whether you are in puberty, or whether you are maybe going through menopause. As for women, you know, how that may affect how your body reacts to um, corticosteroids. You know, it's just, I find it fascinating. That's a whole other conversation for a whole other time. Well, was there any other final thoughts you wanted to share?
Yes, I think for me, at least as a patient, now I'm a pharmacist. I still have many concerns about my medications, and in your previous talks, we talked about medication adherence or struggling to take with your medications. Anything that's, I just want to echo that um, your doctor and your pharmacist are there for you. Um,
Mhm.
our job is to make your life easier while you are taking your medications. And so if you are experiencing side effects that's intolerable, or problems with your medications, including forgetting to take them, struggling with any sort of side effects, you want to let your doctor know or your pharmacist know, because there are alternative out there that may, mitigate these side effects and make your life easier, especially as a lupus patient, balancing a lot of different medications. And so I want you to know that, yes, even though I'm a pharmacist, I still have my struggle with my lupus medications. And it's okay to be honest and open with your doctor and your pharmacist. They're not there to judge you, we're there to help. And so, yes, please reach out if you do need the help.
Thank you. Yes, shared decision making. It should be standard of care, but often we feel like medical professionals in our community maybe are too busy to answer our questions, or we feel intimidated to address them, but they are there to help. They want you to succeed. They don't want you to be sicker and to have issues. They want you to do well and have positive health outcomes. So it is important to follow up with your medical professionals about any questions or concerns you have regarding prednisone. Well, thank you so much for enlightening us and answering all of the questions that I threw at you today. I appreciate that so much. And I want to thank all of you who are watching this for joining us today and taking some time to increase your health literacy and take an active role in understanding your health. So we will see you next time on the More Than Lupus's YouTube channel here. And please don't forget to like and subscribe so that you may be informed as to all the latest work we're doing and support that we offer for the lupus community. Thank you all, and we'll see you next time.